you, HelpAge International, for inviting us and assign me an important role of moderating this discussion session. We will. You already heard the presentations and the outcome of the result of the research and the presentation from the 4 countries. Listen to this one. The first thing came to my mind is about we see the older people not as a burden but as a resource of the society, and how this OPA is promoting not only to care for the older people but promoting the role of older people, and how this also complements the policies and the programs by the government in responding to rapid population aging in the regions is also in discussions, and we see that there's a big challenges also in regulating this the OPA. So the panel discussions will look at what kind of the roles, how the OPA can play in meeting the opportunities and responding to the challenges results from the rapid population aging in the region. So we would like to introduce our panelists. We have here, first we would like to invite these beautiful ladies who sit over here, Ms. Ha to come to the panelists. And we have Britta from WHO. We have Eduardo, you knew him already. And we also have Associate Professor Duc Minh Thi Ha. So these ladies sitting next to me, these beautiful ladies, is the Vice Directors of the Department of International Relations in the Ministry of Labor, Invalids and Social Affairs in Vietnam. And then she's also involved deeply in the work of the Molisas in Vietnam in responding to population aging, coordinating the work of the government of Vietnam with other ASEAN countries, and deeply promoting the discussions around how the countries, Vietnam and also other ASEAN countries, responding to aging and share experiences and learn from each other. And Britta, you met Britta this morning. Britta is Technical Officer from Division of Health System Regional Office for the Western Pacific of the World Health Organization. Ms. Britta has worked with the WHO since for 6 to 7 years already, and including the last 4 years as a technical officer on various issues including gender equity, human rights, and aging in the WHO Regional Office for the Western Pacific based in Philippines. Britta has been supporting the development of the regional framework for the actions on aging and health in the Western Pacific, and its endorsement by the WHO Regional Office Committee for the Western Pacific in October 2013. Britta has worked on a number of different international and national actors for health in development in European and African regions, and we have her today because she's also an expert and with a strong focus on health system reorientations to better respond to the needs and preference of older people in the context of universal health coverage. And next to Britta, we have Eduardo Klien. He's the regional director of HelpAge International East Asia Pacific, and overseeing the work of HelpAge regional leads in collaboration with HelpAge Network, partners throughout ASEAN and beyond. And he deeply works and involved in policy advocacy, knowledge and research development, community-based programs, and supporting the voice of older people toward ensuring that older people can lead dignified, active, healthy, and secure life. We know him that he's an economist, but he's also deeply involved in all other social aspects of support for older people. He's very inspiring and he's full of energy when talking about supporting older people and responding to population aging. And last but not least, we have Associate Professor Giang. He's a director of the Institute of Public Policy and Management from the National Economics University of Vietnam, and also a senior researcher at the Institute of Social and Medical Studies in Hanoi. Professor Giang research goes deeply around the economics of aging and health protections for older people. He has conducted various studies and also policy recommendations for the governments of Vietnam in policy responding to aging on labor, employment, healthcare, and also involved in the development of the social protection strategies of Vietnam over the last 10 years. And he's also a key member of task force for reforming the social assistance in Vietnam, supporting Mulizas and other ministers in Vietnam. So thanks to all the panelists that has joined us to the discussions, and we hope that in these discussions we will discuss about the roles of the OPA and how it can play these important roles as suggested from the results of the research. Firstly, when listening to the discussions and the presentations, we see that, especially in the context of population aging and also the change in various social values in all of the countries in the regions, we see that the issues in supporting the older people from the families has also changed. And also supporting and the government system and services to support the government, to support the older people, who also have many difficulties. So in what way do you think that the OPAs can facilitate the links between community and families and individuals with the government system and services, and how the OPA complements the government policies in that issue, in that areas? I would like to ask Ms. Duc to share with us first, as the person from the Molizas in Vietnam. What do you think about it?
Thank you, women, and sorry for coming late because I'm attending a special course for the national security one, so we need to escape from the course that, to come here. But before coming here, I was already asked the organizer to send me the presentation this morning, and I'd like to thank also the Help International for inviting me here. I'm not really an expert on the issues of the older person, but as one working for the international cooperation issues, and particularly leading some of the ASEAN projects on the aging issues for the social protection for the elderly. We already involved with some of the specialized agencies and also the consultants in Vietnam for preparation process for the Asian society. And from my point of view, because we have listened to the many some countries' representation here, the good practices, the challenges, and also the recommendations for how to link and to promote the roles of the elderly. I think the most important way is that we have the direction. All the countries have direction, have policy already, and we say that the government needs to support, need to involve the person, the older person in the process of the policy making, in the process of implementation, and vice versa. The OPA can also act as a supervisor for the implementation of many of the government-related programs and projects with regard to the older persons. So I think this is first like a background for promoting and the linkage between the OPA and the government policies and the functions itself. But in order to really to make it like to come into the family's responsibility to support the members of the family, we have listened to, I think even the comments from the presentation by Vietnam that we have the intergenerational one. We have involvement of not only the older person in their association, but also the younger one. Because the community, it can only develop in a way that all the people care for each other. And from that point, the person, the older person can also be supported with the younger one. The young one know about the needs of the older one. And with the association's voice, they can raise their voice, they can have representations in working with the government. And even for Vietnam, we also have the committee on the National Committee on for the Older Person, where the Deputy Prime Minister is a member of that committee. And the committee involved and all the leaders from different agencies, from Ministry of Finance, from Ministry of Labour and Invalids and Social Affairs, from the Ministry of Planning and Investment, and everything, and transportation, everyone, they come there. Also with the members coming from the central OPAs. So the central OPA's leaders can also present their voice to the highest level of the society. And we also see here, also we see in the recommendation, in the lesson notes, is a very high commitment, political commitment from the government, because if we want to, we see the best model, the role models that intergenerational self-help clubs already promote the roles from the healthcare, from the income security, and even from the social inclusions. So we present it to the government, to the highest level, and they think, okay, this is good. I can support them because this is the one way, best way to support the family members in caring for the elderly. So I think that's some point I think is very important for this. But as Mr. Klien was already mentioned, the financial sustainability and the resources is very important for maintaining the operation of the clubs, to make sure that it brings the benefits. It also can create the cultural activities and also the inclusive activities for the older person in the community. So it's something for
Thank you. So to you others, Britta, you would like to add? I think that Ms. Duc has shared that one of the ways that OPA can facilitate the link is to provide a channel to transfer the voice of older people in other groups to the government, to the policy leaders. So do you think if there's any other ways that OPA can facilitate the link?
Yeah, I mean, I think, so first of all, I think from WPRO's perspective, we're really pleased to get to this point. You know, as you heard, it was initiated in 2015. I think you saw from the data that aging is somewhat predictable in the region. We know it's going to happen. And from our perspective, we of course we're putting into the health of older people or healthy aging. And one important point linked to that is that while aging is predictable, poor health is not automatic, and it doesn't need to be an automatic consequence of population aging. So for us, it was very interesting to look at the extent to which Older People Association have a potential to help ensure older people remain healthy, independent, and valued members of society. And I think that the report shows the multiple ways that can happen. We've been sort of trying to strengthen work regionally on aging and health, and part of the framework that was mentioned in my introduction highlights sort of 4 areas of priority. And I think Older People Association have a role to play in each of these 4 areas, and the 4 areas are around, the first one is around tackling the social determinants of health through collaboration across sectors, through collaboration with communities. And the second one is around healthy aging and promoting health across the life course. And I think there are 2 things. It's about, making healthy choices across as we are all growing older, but also that there's no age ceiling for health promotion or disease prevention activities. And I think many of the older people associations in this region show examples of how you can promote a healthy lifestyle, have a healthy exercise, a healthy diet, and the roles that older people associations can play in promoting this and providing opportunities to be as healthy as possible as we grow older, whether it's at age 60, at age 80, at age 100, it doesn't matter. There's so many things we can do. The third area is then around what is the health system's response and how can we reorient health systems to better meet the needs of older people. And this is really recognizing that a lot of health systems are not currently reoriented to deal with older people. There's a lot of health systems that are still focused on acute episodes of care, and again, it's about looking at what are the types of services and support that older people and communities can play, because population aging or aging as a trend, it will not be able to be solved or dealt with by one actor or one institution or one community, but it requires collaboration across multiple stakeholders, including creating a link with the formal system and having that back and forth between communities and the system, including in terms of referral of services, linking or helping to navigate the system between health, different types of healthcare, different types of long-term care, formal and informal. And I think there's a huge potential again for Older People Association to play that role and to help.
Yeah, thank you, Britta. I can see that there's a clear role as a mediators of OPAs in this context. So does Eduardo and Professor Long, do you think that it has any other links that the OP could play? And also, we see from the report that the OPAs actually have many impacts in improving health, income, social securities, and on others, on other aspects. So what do you think that, in what sectors do you see that there's the most important impact of OPA? We see that there's many impacts in many aspects. But maybe I could ask Professor Long first, because from the academics and researcher point of view, what do you think that there's the most potential for the impact of the OPA in which sectors?
First, thank HelpAge for inviting me to join this panel, and I think the question is really important to emphasize the role of OPAs in aging population and also to support older people. But before I answer the question from the moderator, let me try to say that when we are talking about the aging and older people, we should distinguish them in different characteristics. The first one, when we talk about aging population, it means we talk about the process of population change, where we have more and more older people. They account more percentage in total population, right? But when we talk about the older people, it means we talk a very specific group of people at a given point of time. And they have very different characteristics in terms of social, economic, and health indicator. So back to the question about the OPA role, the most potential one, I think we should emphasize in which phase of aging population in Vietnam and in other countries, we should emphasize the role of OPA. For instance, in Vietnam now, when we talk about the current older people, we can see that older people in Vietnam facing a lot of issue, economic insecurity, because just only merely 25% of them covered by pension, and also other 25% covered by social assistance. It means we remain about 50% of them without any support from government, for instance. And they are also facing a lot of problems with health issues. So I think that the role of OPA now is to support, to link between the demand, it means the need from older people, and also the service provider, the supply. For instance, because OPA working closely with older people, so they understand quite well about the need of older people, right? About income security, about the health care, and about even social care. And then they can respond that kind of needs, to the local authority. And then, this local service provider, in order to provide at least something to meet with the demand of the older people. But in the future, I think, like when you talk about the future older generation, like me now, right, at age 40, so in 20 years' time or 30 years' time, I will be older people. So if look at me or my generation, you can see that maybe we are good in terms of income security, but maybe we are not good at health care, for instance. So we need to emphasize what kind of, the most important need for older people in each phase of time in order to provide specific, services with the role of the OPA. That's my idea for that.
Thank you, Mr. Long. Actually, thank you to clarify between aging and older people. And I think that is also the issue that in Vietnam when people talk about aging, and it's kind of automatically think that aging is older people, but actually it's bigger than that. And therefore, it's also important to see that whether how the older people, the OPAs in each of the periods in the societies in respond to specific needs of the older people and also near old people in the future. Right? Eduardo, would you like something to add? What do you think that would be the most important roles of OPAs in responding to aging, and in also promoting the opportunity that aging bring about? We are not talking only about the challenges, but we are also talking about the opportunity that the aging population will bring about. So what do you think, and what recommendations do you have for the governments, for any other actors like international organizations, academics, or civil societies in promoting OPA?
Thank you. Thank you. Yeah, we are all growing old. I'm a bit ahead of the pack, no, but in the room at least. But aging has two components. Has a personal, biological component, but it has a social dimension. And I think both are closely interlinked, because what one person who was old 20 or 30 years ago, at the same age, at the same biological age, is not old now, because very many components. And this is also affecting the social perception of aging. So we have to understand that societies also have to adapt to this new demographic configuration, as I said. And one of the key elements is this OPAs. OPAs are a tool, are a means, and are an end in itself. Are a means for getting people involved, promoting active aging, promoting engagement with the community, promoting home care, promoting income security, and of course promoting many other things like disaster prevention. So OPAs in that sense are a tool, but are also an end in the sense that they are the space that will allow people to be human beings, be active social entities, not isolated individuals that are seen as a problem. Yeah. And for this, we have to also change the social perceptions. We have to change from seeing this equating older people with vulnerability, older people with need, to older people with, as a potential, as a resource. Look at Mr. Dam, if I may take your example. Mr. Dam probably retired 10, 12 years ago, maybe, I don't know, maybe less, maybe 8 years ago.
7 years.
7 years ago, sorry. But Mr. Dam is with an enormous capacity. He has been Vice Minister of Molisa for some years. He has a huge experience, he has a huge legitimacy, skills, and he wants to contribute, he's willing to contribute. But like Mr. Dam, there is hundreds of others who are thousands of others who live in their communities and also want to contribute to the well-being of their communities. So the OPAs is the space where they provide that, yes? And if you, I'm not going to talk much more, Dr. Quinn, but I want to say, you know, in Vietnam, they all, or in China, they always say the 3 Ps, the 2 Ls, the 2 Is, no? I want to say, if we want a world with a social fabric that creates these spaces, we need to have 3 Ps. Sorry, 3 Is. I start with the 3 Is. Imagine a fair world with all the things that, with plenty of, with fairness for all generations, including older people. Imagine, innovate, like BAE and HelpAge have done in Vietnam, have done a huge innovation and exploration. So imagine, innovate and involve. You cannot do anything without the involvement, active involvement of people, of older people. That's 3 Is. 3 Ps, prepare, yeah, in your mindset and prepare in your countries for developing this OPAs. Promote them actively, build political will. So promote, if you talk with the government, if you talk with older people, if you talk with the religious organization, with anyone, you are promoting this role of OPAs. And then persist, because sometimes you need to persist, be like Quinn, insist. So 3 Ps, prepare, promote, persist. And the 2 final is the 2 Ls. Learn and listen. Learn from others and listen to older people. So I think that's all I have to say.
Thank you. That is very comprehensive. And we see that you know from the OPA is actually have a really big role. It's not only in supporting the older people, but actually the place to promote them, to keep them to be kind of inclusive, like the UN is always saying, an inclusive society, and keeping people and allow the people who want to contribute to continue to contribute, and also the government and the countries also can take advantage of that, because older people is actually the richest source of skills and knowledge and ability. From an international organization's point of view, what do you think that we could do, or recommendations for to promote the OPA or to improve the OPA, to make it grow more steady and sustainable? What do you think, Britta?
I think OPAs are a strong part, as said, like sort of across the whole range of sort of all 4 areas that we would see as priorities in terms of health and aging. I think just the last one that I didn't mention earlier was around strengthening the evidence base on aging. And I think this study, but also the experience that we heard in the room, are a good example of how useful it is. You know, when we talk about the evidence base, like, it's also about the quality of information, it's also about people's voice, it's about experiences in communities themselves and how they can be useful to inform policy making and implementation of those policies. And you know, the study is one example of this, but there are many other experiences in the room and in countries that we can learn from. And it's really important to capture those experiences and share them across the region. And that is a role at the regional office that we try to do, because I think there's a lot of good examples that we can see across countries at the community level, and sort of part of our role is to disseminate those, to collect those good practices, to disseminate them, and share those lessons. While there is a lot of diversity across systems, and country context is really important, so it's not possible to transfer a model. I think we see also many common trends, and one common trend we see in the region is around how can we support aging in place? How can we support community-based models that bring together a whole range of different stakeholders? And And the OPA model is one way that we can make that happen. So I think that to me is, in terms of strengthening information and informing policies, the one important part. I think the other one is that link to government policies, and I thought it was really interesting to see in the country presentations and how each of them reflected on the link to government policies and or government systems. And I think that was also one of the recommendations from the studies, that it's more sustainable if that link between the support to the government policies and the system itself and OPAs as the important stakeholders that can help to sustain and strengthen the response.
Yeah, thank you, Britta. What you said was very important regarding the data and evidence. It's also linked to what Dr. Long has shared, Professor Long has shared, that need to identify the needs of those people. So each country is in each region, in each different various phase of the society development, and to also link evidence also to identify the needs of the people and respond to that relevantly. I don't know if Ms. Duc and Professor Giang Thanh Long could share some of the recommendations that you would like to share, that what you think to promote OPAs and make it better before we close the discussion.
Okay, I really agree with Britta for her recommendation, because I think that we have done many best practices, but how to promote that one, we need to communicate it to the public. And I prefer using like the media, like I think particularly the televisions, maybe the nationwide television, we should have sometimes like broadcasting the best models of the very good clubs, so that all the people see, okay, there's something that we can do to work together and to support to promote the roles of the older person in the community. Because we see many of the benefits bringing about. It can also not only to promote the health and the life, the well-being of the person with the older person in the community, but also contribute to reduce the burdens of the government in terms of even the income security, in terms of the health services for them, because the community themselves, they support each other. That's one of the best way that we can do. And with regard to the sharing at the international and regional levels, I just want to inform you that today the SOMSWAP, the senior official meeting for ASEAN, is meeting in Myanmar, and they are discussing one of the topics for that, social protection for the elderly, under the framework of ASEAN Action Plan on the enhancing, strengthening social protection in general. So they are talking directly with the social protection for the elderly. And then I think many of the best practices will also be shared there to support with the even the health services, income security again for the person, the older person. And I think that one of the very best way that we can do together. And even for Vietnam, we are leading an ASEAN project, exactly the name, social protection for the elderly. And also we are leading a project in the labor sector, so security, social security, the financial sustainability in terms of social security. So we talk all about that one in different sectors together. So I think that's a very good way that we work together, evidence-based, sharing best practices and recommendation at the regional and national levels. So I don't know if Long wants to say something.
Thank you. From the perspective of research and also advocacy, I think I will agree with Duc that at least now for OPA, we should promote the activity of evidence-based, research to advocate, the role of OPA to different authorities from local to central, level. The one that we are doing now, and with 4 presentations from different countries, I think that's also a very good one, to advocate to the government, showing that okay, we are not just gathering older people, but we also have them in order to reach with income security, health security, and also social participation. So I think this kind of piece of information, I think it should be delivered directly to the people who are in charge of older people and also aging related policy in different countries. And the second one, I think that from Vietnam's experience, I think OPA also have very important role to reach with the top leader people, right? If you just say something very general one to public, that's fine. People understand about aging, people understand about the older people. But really, the change in policy will not be happen if top leader person, they don't understand the situation. So I can say like General Secretary of Communist Party in Vietnam, Mr. Chong, right? He just mentioned about, okay, we are maybe face the problem of getting old before getting rich, and also maybe we miss the demographic dividend. So now all ministries, they have to explore the situation, how to avoid that type of issue. So I think when we reach the top leader, it means we can change the policy. And last but not least, I think if OPA can change the policy, there are 3A, right, compared to 2L, 3P or something. OPA can help older people to be accessible to adequate and affordable services in their life, I believe. Thank you.
Thank you. Thank you all for a very rich discussion. I learned a lot from the panelists today. And we see that the OPAs, the role of the OPAs can play very important roles in various aspects in improving the living standards of older people and also responding to population aging. We see that OPA can consider as an important channel to raise the voice of older people in other population groups. But not only just raising the voice, but it also can bring those voices to the top leaders. We know that maybe not only in Vietnam, but also in other countries, older people, they are the voters, they are the key voters, right? So the OPA can also bring their voice to the top leaders, to the policy makers. It also plays a mediator's role and also a very strong coordination role between the communities and provide various stress on the change of the systems. Say, for example, health systems. And now I know that the government of Vietnam Ministry of Health and also work really hard to change to renovate the health system response to aging and to provide to meet the needs of older people. It also plays a very important role in keeping the older people involved and inclusive in the societies, taking advantage of all the abilities that they have. And we heard also recommendations from the panelists. And I think it's very important to provide evidence and data on older people, on the needs of older people, and also the lesson learned. Good lessons is also not so good lessons that they can learn from, and communicate the evidence and data widely so people and policymakers can make an informed options on policies. That is important, and those policies and programs by the government respond to the need of that or the older people in each country's context. And in terms of recommendation, we heard about the 3 I's, the 3 P's, the 2 L's, and the 3 A's. So we hope that is after these sessions, that's what you can take away from these sessions, and how to apply those I's, P, L, and A's in your countries. Thank you very much.